I want to start off by letting you know that we unfortunately have had a death here in British Columbia. We are deeply saddened to hear that one of the residents of the Lynn Valley Care Home who was infected with COVID-19 passed away last night. And our heartfelt condolences go out to his family and loved ones, and also, of course, to the staff who provided him care and to his home at the Lynn Valley Care Centre. We also have a number of new cases, and I'll start with talking about what is going on at the Lynn Valley Care Centre. We're up to 32 confirmed cases here in British Columbia now. As you know, the Vancouver Coastal Health has been on site at the Lynn Valley Care Centre since we first became aware that the community case that we had was a healthcare worker who worked at that centre. It's now become apparent that there are other people at that centre who were ill, a number of residents, as we know. So far, 2 residents have tested positive. There's ongoing testing and ongoing monitoring of all of the residents at the facility. In addition, one additional healthcare worker has tested positive for COVID-19. She's a woman in her 40s who lives in the Fraser Valley, Fraser Health Authority area, and she is home in isolation right now. In addition, we have 2 new close contacts of case 21, our community case, a male in his teens and a male in his 50s, and they both reside in the Fraser Health region and are isolated at home, and both of their condition is also stable. Over the weekend as well, we've identified 2 additional imported cases into British Columbia, a female in her 50s who has returned from travel to Iran, and a male in his 30s who is our first imported case with a history of travel to Italy. Both of them are in the Vancouver Coastal Health region, and both, again, are isolated at home and doing well. I will also give an update on our other cases. So we still have 4 people who have recovered completely. We are awaiting testing on a number of others whose symptoms have resolved completely. But as you know, we are requiring people to have negative tests before we say that they are fully recovered from this. And a number of them have been tested regularly, but do not yet have 2 negative tests, at least 24 hours apart. So we are monitoring those. We have 3 people who remain in hospital, 2 people in the Fraser Health region, and they're both in stable condition, and 1 person who remains in the ICU at Vancouver General Hospital and is also in stable condition. A couple of things that have come up over the weekend that I do want to mention. One is there has been some letters gone to some schools in the Fraser Valley region, mostly to reassure people. There were people who were in those facilities who have tested positive for COVID-19. However, they were asymptomatic, which means we do not believe there is a risk to people who are using those facilities. The schools have been very proactive and did additional cleaning over the weekend to make sure that everybody is reassured that they're safe, and that we have processes in place in all of our schools now to enhance cleaning, to enhance measures for people to be able to clean their hands regularly, and we'll be monitoring those situations, of course, as these go on. We've also, today, the federal government has increased their travel advisory warning for people who are planning to go on cruise ships. We have had a number of people, as you know, who've returned to British Columbia who were on previous cruises, and so far 2 people have tested positive for this, and they're both people who are in hospital at the moment. So we are really pleased that the Canadian government has recognized the risk right now that traveling on cruise ship ships does give people, and we know that there's the Grand Princess off California. There's been some cruise ships in Egypt as well where there have been cases, and it's just an environment where people cannot separate from each other sufficiently to prevent transmission of respiratory viruses. And with the ongoing outbreak that we're having around the world now, there's really no way to effectively screen people out of cruise ships. And so it is really taking a chance on your health at the moment. I don't think this will last forever, but the federal government has upgraded it to a level 4 warning, which is to advise against going on cruises in the near future. The other thing that we have been getting a lot of questions about is about events and whether we should be cancelling community events. I talked a little bit on Saturday about some of the closer environments, indoor environments where people do gatherings, where people share meals, where people spend a lot of time together in closed environments. And I'm asking people to consider having alternatives to those types of environments right now, particularly if they're being attended by people who are elderly, who are more likely to have severe illness or complications from this virus. So we'll be talking some more about that, but to forego some of the things that we do sometimes in greetings, in hugs, kissing, shaking hands, and to try and put some distance between us, even in small events, in business meetings. Look at how we can do these things virtually. There is also a lot of risk assessment that goes into events, larger events that are happening. We had the Rugby Sevens on the weekend, and there were different measures that were put in place to ensure where the teams came from, to ensure there were provisions in place to separate people if we can, to make sure they could clean their hands regularly. And each of these large events is taken on a case-by-case basis, and we do a risk assessment about who's attending, what the environment is, how long it is, and all of those different measures. So that will be ongoing, and I know a number of events have been cancelled, and there's a variety of reasons for that, and public health is here to support people in those decision making. And finally, I wanted to bring up a disturbing thing that we've been made aware of, is that some people are calling people and offering them fraudulent laboratory testing for a cost. And we're telling everybody in British Columbia there is COVID-19 testing is done by our lab, which is an accredited lab. We are moving it out to several other labs around the province, but this is all done for free. Our turnaround time is very quick, and they do not and should not be asked for money and should not be paying people. So be aware that there is, for some reason, people trying to scam people around getting testing in this province. Thank you.
Thank you. And so thank you very much, Dr. Henry. This is obviously a very sad day for all of us, but especially, of course, for the family and loved ones of the man who passed away at the Lynn Valley Care Home. And our hearts go out to the family, to the care family, to all of the people who work at the Lynn Valley Care Home. This is obviously a very sad day for them, and indeed for all of us who are working on this question. Today, Dr. Henry has announced 5 new cases, which means the total of cases is up to 32. And the majority of those cases, 16, involve in some way travel to Iran. So half of the cases, 5 involve in some way travel to China, and obviously travel from other places. And then there's the significant issues that we see at the Lynn Valley Care Home. I wanted to say that what this shows is what was said on Friday in the detailed briefing we gave to reporters in the community, is that some people are very vulnerable. People with pre-existing medical conditions are more vulnerable than others. And obviously people who are older, over 80, are vulnerable. We saw in the evidence that was presented by Dr. Henry on Friday from Hubei province that somewhere over 14% who have COVID-19. So the situation for all of us and the responsibility for all of us is significant to not go out when we're sick, to not work when we're sick, to not go to school when we're sick, but also to not visit care homes, to not visit hospitals, and to not visit our friends and our family who are older if we're sick. And I think we wanted, of course, to reiterate that today. Dr. Henry has talked about some of the other issues, but we also want to continue to praise people who are providing care around the province and in all of the work they do. People involved in this matter, from Dr. Henry to the people at BC Centre for Disease Control to health authorities, people who work in care homes, are enormously committed to people, and we want to acknowledge today all of the work that they do and all of the work being done and the support they're getting from members of the community. On some of the broader policy questions, as you know, the federal government made its announcements around cruise ship. We wanted to both thank the federal government for increasing their warning to people about traveling on cruise ships and for their efforts to bring people home from the Grand Princess, Canadians home from the Grand Princess. Their determination to do that is much appreciated, and I think we need to acknowledge the extraordinary work done by federal officials on previous evacuations, in particular from Wuhan and from Tokyo.